Hello, I'm Inge Peterson. I'm the Director for the Centre for Rural Health and a Research Professor in the College of Health Sciences. I'm with Associate Professor Zamasomi Levuno.
I'm the Deputy Director of the CRH. We are part of the team that works with the grants that are related to health system strengthening.
So I'm going to start off with just a bit of background on the CRH. So it was initially formed in the late 1980s under the leadership of Professor Jerry Kuvadia, who was an anti-apartheid health activist, very well known. It was really formed as an advocacy a group, as well as providing technical support and really wanting to use research as well to promote more equity in healthcare under the apartheid government, with a focus on primary healthcare as well as community-oriented primary healthcare. And then in the 90s, it came under the leadership of Professor Hugh Philpott, who was a very well-known maternal health specialist. And this was followed by Professor Steve Reed, who took over, I think, in the mid-1990s. And at that point, Steve Reed was a rural health activist. And so he shifted the focus of the CRH towards rural health. So initially, under Professor Jerry Kuvadia's leadership, as well as Professor Hugh Philpott, it was called the Centre for Health and Social Studies. And that really encompasses and spoke to the social determinants of ill health as well. Under Professor Steve Reed, the CRH then shifted focus towards rural health specifically, and underserved areas. When Professor Reed left for UCT around 2010, Professor Bernard Gady, a family physician who now leads the discipline of family medicine in the college, took over for a few years, and he really was very instrumental in developing the strategic plan for the CRH, which was then known as the Centre for Rural Health. And that strategic plan had three major strategic thrusts, which was health system strengthening, human resources for health, as well as health and social justice. When Professor Gady became the discipline head for family medicine, I was asked to come across, and that was around 2016 from psychology, to really take over the leadership, but also to steer the Centre for Rural Health to become more of a competitive research-funded organization. Previously, it had been funded largely by philanthropic funding, donor funding, which was drying up at that stage. And so since I've been there, we have had a number of large research funded grants from, for example, NIH, NIHR, and various other research funders. And in the last 2 years, we underwent a 5-year review of the centre by quite a prestigious panel. And out of that review, there were recommendations that we really focus our work on health system strengthening, as that was our strategic advantage, and particularly to build on the learning health system approach that we've established through working with the Department of Health through the Primary Healthcare Transformation Committee. And since then, and so just recently, in the last couple of months, we have had a name change on this recommendation. So we are now the Centre for Research in Health Systems, but we have kept CRH as the acronym because of it is a very well-known brand in the community and by the department. I'm now going to hand over to Professor Levuno to talk a bit about how we work with the Department of Health and other sectors through the Primary Healthcare Transformation Committee.
Thank you. So as Prof. Inga has just said, that our focus is really on health system strengthening. So in 2018, we really formalized our relationship with the Department of Health. That relationship started really with the Chief Director of the District Health Services, where really primary healthcare services are housed, who came to us, the Center for Rural Health at the time, to say, can we form a relationship that will support the changes that were happening in the Department of Health. They were really working towards strengthening primary healthcare approach, and they felt that this relationship could help them as they move with this journey to make sure that it's evidence-based, to make sure that whatever emerges is really in line with international thinking, aligned with research, and also to support them in testing some of these innovations. So really this relationship was then formalized, where we then agreed that we will work together, not only in strengthening the health systems, but also whatever that is emerging and we're learning, we are going to also infuse into the curriculum for pre-service people that were training in the university, and also to enhance the training that they are doing for people who are in service. This work, as we said, it started in 2018, so it means we've been going about 6 years, quite formal. We do have structured meeting times. We do have specific things that we want to achieve. As part of this process, we then developed a theory of change. Really, a theory of change is coming together and saying, what do we want to do, what do we want to achieve? And the starting point for this theory of change, we started with what the Department of Health is aiming to achieve, that long and healthy life for all South Africans, in this case for KwaZulu-Natal. We looked at their impact indicators and then we moved backwards. This theory of change is in 3 layers. We look at the community, because that's another layer where they felt they wanted really to strengthen that community-based, ward-based outreach teams. Then we have got a primary healthcare level, which is looking at primary healthcare facilities, and then at a leadership level. Because the thinking was, you can't change practice without changing leadership policies, and so that's our starting point. So to make this theory of change implementable, we then formed subcommittees. These committees were allocated specific items to work on, which are aligned to this theory of change, areas where we felt we needed to work on. Another thing that we are doing quite extensively as the researchers, because our role really is to bring innovation, test the innovation. Not only that, but we then customize it to our area, because some of these innovations are done elsewhere in the world, and then our role as implementation science researchers is then to repackage so it is aligned to our area, our resources. So that's the work we do.
So I'm Andre van Rensburg. I'm a high impact associate professor at the Center for Rural Health. My primary research interest is in integrated mental health care, but in a broader sense, health system strengthening in the public sector. Of particular interest is creating a system where people with severe mental disorders can receive care within the communities in which they live, and to strengthen those systems of care. And in that capacity, we've been able to do a lot of very interesting and progressive work in the province of KwaZulu-Natal.
The relationship with the university, between the department, it's actually bearing fruit. You know, the strength of the university is research, of which when we come from the government side, our strength is implementation. So we needed something that can complement what we implement, so that we can be able to, even if when we argue for resources, we should be able to have factual things that have been proven in terms of the research. And also it assists because, you know, we also grow older. There are people who are going to come after us, and then instead of trying what we have tried, they can go and look and read what exactly we have tried, where did we fail, so that they cannot repeat the same mistakes.
So how the university is helping us as a department, since our partnership commenced some years ago, we've been able to co-design and co-create the interventions or intervention strategies to address the health system's issues or challenges. The university assists with research and evidence-based information for us to be able to then implement those interventions that are evidence-based for us to be able to address issues and make progress, if I may say so. And the university also accesses capital or funding or grants for us to be able to implement projects, because as a department we are not having enough or adequate resources, could it be budget or money, human resources and other resources. So working with them has helped us to leverage some of the resources.
So the vision of the Centre for Research in Health Systems is really to strengthen the health system in South Africa across the lifespan, from early childhood through to late adulthood and the elderly, using this learning health system approach, which Professor Levuna has so eloquently described. Thank you.